Welcome to Southcoast Matters. I'm Steve Kerrigan, sitting in today for Paul Letendre.
And I'm Julie Taylor, and Steve is today's co-host, and he's a former senior aide to the late Senator Ted Kennedy, former candidate for lieutenant governor, and former chair of the DNC and the DNC presidential inauguration. Is that what it was?
The Democratic National Convention and the presidential
times
inauguration.
two.
Yeah. I'd like to stop being the former something, which is nice, but.
Well, you're currently our co-host.
That's right.
And a prior guest on our show.
That's
so
right.
We're very happy to have you back.
And glad to be here. And our guest today again is Peter Letendre, CEO of Clinical Services of Rhode Island, which provides outpatient rehab and addiction treatment services after his own recovery from drugs and alcohol. Peter worked with at-risk youth and in the first time in many roles in prevention programs. So we're glad to have that.
And so Peter continued his path and graduated from Rhode Island College with both a master's degree in mental health counseling and an advanced graduate degree. And you're a licensed alcohol and drug counselor as well as a licensed mental health counselor. You've got a lot of hats to wear.
And today we're going to just continue the discussion that we had on our previous show about drug addiction and abuse and some of the prevention programs and therapies. And so we're thrilled to have you back, Peter. We thank you for taking time to come and join us again today.
Thank you.
So we thought maybe in this show we could talk, well, you could tell us a little bit about your own personal tie-in with addiction and how you came to get into this business.
All right, it's going to be a few minutes. Let me just, I always start with this and say my name. My name is Peter, and I'm a person in long-term recovery. So what that means for me is that I haven't had to use a drink or a drug in over 29 years.
Wow, congratulations.
So, I'm 47 years old. No, 46 years old.
Yeah, don't age yourself. I'm 46 this year, so don't age us.
At the age of 17, I sought treatment and got some great care and was able to remain sober since. So for me, I grew up in a nice little town in Portsmouth. Had an intact family. My parents were married. Was the first of three children, and had a pretty good childhood growing up. Nice quiet town again, where it was safe. It was no violence, and relatively a nice area in Rhode Island. Spent a lot of time on the water. Spent a lot of time, riding dirt bikes and playing sports. But growing up as a kid, I don't know, I always felt like I wanted to fit in, let's just say. I always felt like I wanted to be seen, but I was kind of a quiet kid. Maybe had some difficulties with that. By the time I was 10 or 11 years old, some of my friends were experimenting with marijuana, and I decided to try it.
10 or 11, wow.
And it was great. I enjoyed it. I had some experience with alcohol in my family. Let's just say, growing up in my family, we had there was always a lot of alcohol floating around. Both my grandfathers liked to drink a lot. My dad, my uncles, they all, liked to drink pretty heavy. So I probably had my first drink. I know I had my first drink with my family, with my dad specifically. And so growing up, to me, alcohol was kind of normal. To drink was normal. And I wouldn't say that I was given permission to drink, because that wasn't the case, but it happened on occasion around the family. So by the time I was 10 or 11, like I said, I was smoking marijuana periodically with friends. I liked the way it made me feel. I could get outside of myself. I could be more talkative. And I felt like I was somebody. I felt like I was somebody important in that moment. So, I say dibbled and dabbled with alcohol and marijuana up until high school. And in high school, it started to become a more pronounced thing, where we were, friends doing it on the weekends, doing it after school. Started to smoke before school every once in a while. By the time, actually the end of the freshman year of high school, I remember a friend of mine, we took a bottle of tequila and decided to try that, and we drank the whole thing.
Oh, wow.
Wow.
And I don't remember much of that, other than the fact that I was brought home by the police because I was passed out and had fallen in a lake and had to be pulled out of the water, almost drowned.
Oh my God.
So that was a blackout.
And
First
how old were you
blackout.
then?
That was 14.
Oh, wow.
Age 14. So, I woke up the next day in my house, no clothes on, not knowing what happened, and, my father had to tell me what happened. He was pleased.
I bet.
And then later on, he made me go up on the roof to clean the gutters. So, punishment.
Of every house in
That
the
didn't
neighborhood.
teach you?
Yeah.
Well, he thought it might, but But those are some early signposts, I guess you would say, but it continued to go on like that, and I started to experiment more with other drugs. LSD was very big when I was in the 80s, cocaine. Those are the main things at that time we were using. And I remember that some things would start to happen where I would feel like, maybe tonight I shouldn't drink, or maybe tonight I shouldn't smoke. But I would be around it and I would do it. And that's when I started to feel like maybe I didn't have much control over this. So,
and how old do you think you were around this time?
That was about 15,
so
16.
early signs that
right there, it was starting to become
yeah.
apparent that there may be something going on here. And then age 16, I would I actually go through some periods where I stopped. I'd say, I'm going to stop. And I stopped for like a month. And then the only way I could do it is I had to avoid everybody that was doing it. I'd have to almost like lock myself up in it at home, or sometimes it would be because I was on restriction, maybe for getting in trouble, and I'd be locked up at home, or for getting bad grades. That's another issue. But I was a horrible student, number one, and it was because I really couldn't focus and concentrate in school. That was a problem that I had throughout my life, but it got worse when the drugs and alcohol were introduced because,
Your parents didn't notice?
I think they did, and they, teachers would have us come in for some parent-teacher conferences and say, your son has some comprehension problems in school. Now we might say your son needs to be tested, and maybe you might see that your son's got ADD. You might, those might have been some of the conversations that would have come up, but didn't back then. So all the while, my substance use continued. The crowds of people I were around, kind of, one of the things when you hear about people who are struggling with substance use is they tend to gravitate towards people who are, we call it lower companions, meaning people who are doing worse things than you are. And so that way you don't feel like you're doing so bad. Right. So that continued to happen. I hung around with a lot of older people that were just doing things that were just, now I think really unacceptable.
Is there a link, do you think, between the not being able to focus in school and studies to early susceptibility to a sort of an addictive, like trying to mask almost?
Well, there is. There's a lot of research done now that I know as an adult that there's a lot of research done on co-occurring disorders and other psychiatric disorders that if you have something going on, you're a lot more susceptible to have a substance use disorder. For me, it didn't help me to focus, but it just helped me to relax and to be more outgoing, and I liked how it made me feel, and that's the feeling I wanted to have, and that's the feeling that I chased. So by the time I was, like I said, 16, I was starting to feel like there were some problems here. Got into cocaine for a bit, and there were some times when I thought I was going to die doing cocaine, and nobody really knew about that, but I knew about that. And then I started to think, gee, maybe there is a serious problem here because I can't control what I'm doing. It just, people say, it gets worse, and that's what I was seeing, the progression. Now, I didn't really know much about substance abuse, and there wasn't a lot of, there was some stuff in our schools, but I do remember this one particular production that was done at my school. It was a story about a boy who died from drugs. I remember the production. And it was called Eddie Was Here. So I saw this play when I was in high school. Then when I got into recovery, actually, that's the first prevention company I worked for. I worked for that company, and I ended up playing the part of the boy who died from drugs. I'll tell you that story in a minute. But by the time I was 17, I was getting into a lot of trouble with my parents, kind of leaving home, coming back home. I was still going to school. I always worked. I always had that strong work ethic regardless of how bad I was, but mentally I was not well. I was really depressed, I was really down, thought about suicide on a regular basis, I think. Didn't feel good about myself.
Did you at the time seek any, just in general support for those feelings, not necessarily related to the drug stuff? Or no,
I didn't tell anybody about that. I just kept on drinking and taking drugs, Maybe when I was drunk, I would talk to my friends about it,
Right.
but I never talked to my parents about it.
School personnel wasn't as trained in those kind of issues as they are today.
You know, I think I stayed off the radar too, and you know, I would get into trouble. I was more seen as a troublemaker in school,
Rather than
you
a
know,
kid
as
in
opposed
trouble.
to,
Yeah.
you know. So, but when I was around 17, I had a couple friends of mine that parents made them go to rehab. So that's when the idea really started to come into play. Like, wow, maybe there's something wrong, and maybe I can do something about it. So, at one point, I did break down and tell my parents that I thought I needed some help, and so my parents got me into a program, and I was in the middle of my senior year of high school, and it was the best thing I could have done. It really was like flipping the switch. I felt like a different person when I got the help that I needed. And I went to an inpatient program, and then I did an outpatient program, and then I've been involved in self-help meetings in the community for years ever since. But recovery is not an easy road either.
Not especially when you're 17 years old.
No,
either.
it's not for
Right.
anyone, and it's not when you're 17 because people look down and go, "Oh, you're only a kid. What do you know? How bad could it have been?" Well, it could have
Right.
been. It could have been.
And it's
death.
not a road that has an end.
Right,
Yeah.
right. So after high school, took some college courses. I did pass high school, and at graduation I got an award for being the most improved student.
That's great.
That's
Great,
something. That's good.
excellent. I was like, wow, okay. And I didn't do anything different other than just not do drugs.
Right.
And showed up for school.
Showing up
So
is
that's
part of the
it.
battle. Yeah.
So it was nice.
Yeah.
The school recognized that, and so after school I started taking some college courses. I didn't know what I wanted to do. I was interested in music. I took some music courses. I did go to a music school for about a year, and did that for a little bit. But I got this job working for the play. I was sought after for some reason. I was a young guy in recovery. So this play traveled around in New England to a lot of different schools. It was called Eddie Was Here. It was a story about a Rhode Island boy that died in 1978 from alcoholism on Thanksgiving night. And his family didn't know what to do other than try to use his death as a positive experience for others. So what they did was they hired me to play the part of the boy who died, and at the end of the show I'd come out and share my story about being in recovery. And I talked to high school kids, which was great because I was just out of high school.
Yeah,
and,
you were just
and could really, on their level, could really understand what they're going through, and it was amazing. I did that for about 2 years, and then basically a lot of things happened. I ended up getting married, had a child, had another child. So I have two adult children, a 25-year-old and 23-year-old daughters. So while I was married and all that stuff, I got a job working in a warehouse, and I would work the night shift in the warehouse, and I would go to school during the day and try and take care of my kids and take care of myself. So I did that for years until the mid-90s when I started working in a hospital setting, a psychiatric hospital. It was great. I learned so much there, and throughout the years I continued different jobs in the field until I finished grad school, and then I started working on my own. But I worked at a lot of different agencies, substance abuse agencies, psychiatric facilities, and each place gave me a different piece of the puzzle.
And is that what you? So it's interesting because a lot of folks go through recovery, as you know, and a lot thanks to you. And not all of them then go into the recovery services and the clinical services business or that line of work.
Yeah.
So it's interesting that that's sort of what you chose to do, but over a period of time. And I liked your language that everything was a different piece of the puzzle.
Yeah.
So I wonder, were you as a 17-year-old entering recovery, still looking for the reasons why you got into the situation you were in the first place, and
That's right.
and the pathway out? And I wonder if you could talk a little bit about that.
Sure. I mean, at age 17, I didn't know what had happened really. I did spend a lot of time in therapy after that too. I went to see a therapist for many years, and I was going to recovery meetings in the community, but I continued to do therapy probably for about 5 years after that, and really started to look at some of the underlying issues that I spoke to regarding self-esteem and maybe and also things in your family. There's always things in your family that come up in families, communication with parents, lack of communication with parents, all that stuff. So, there was a lot of little pieces, and it was all brewing. It's kind of how I look back, and it was a perfect storm. But that continuing to do my own therapy and to continue to do my own work was crucial, because I wouldn't be where I am now if it wasn't for that. And it was when I was sitting on the therapist's couch that I realized that this is the work that I want to do, you know. So, and this therapist is still a mentor of mine. He's not my therapist anymore, but he's a clinical mentor. He's retired, but a great man who helped me to kind of walk through the woods, so to speak, you know.
Yeah.
So.
And teenagers are very vulnerable. They feel a lot of peer pressure. And I noticed that earlier in our conversation, you talked about how you talk to your friends about getting drunk and that kind of thing. So I'm wondering if, when it comes to students in high schools or even middle schools, since we have to start younger to get to them, would it make sense to have peer people they could go to, maybe some kids that are not involved in drugs, that may have a little bit of training to just that you could talk to, so that they could alert people? Or what would you think about something like that?
That's an interesting idea. I mean, the more discussions we can have that are on the informed and educated side, I think would be helpful, you know what I mean? Because kids, I think in general, can be hesitant to speak to adults, but I see that, you know, student assistance and guidance counseling in the schools, it's come a long way. They really do connect a lot with the kids now, and they do a lot more. They've learned, I think, over the years to have more connections, but in school systems and in the community, I think, yeah, that's an interesting idea. In the recovery field, we have something called peer recovery coaches, which is kind of like a paraprofessional, someone who's not necessarily an addiction specialist, but someone who's in recovery themselves. They're called in a lot of cases to speak to folks who are struggling. So if you report to the emergency room, Joe Smith, the recovery coach, is working that territory. They come in and talk to you and just talk to you about recovery, and from person to person, maybe they'd share their story a little bit with you about being a person in recovery and what helped them. And that's very powerful, you know. I mean, professionals are great, but sometimes they need to hear it from someone on their level a little bit, you know.
Right.
So let's go back a little bit, if you will, to the time you were working in hospitals, in a hospital setting, and at this phase you have two young kids, you're trying to make sure they're fed and get educated. Talk a little bit about sort of what you learned in the hospital setting and how that continued this sort of journey in filling in the pieces of the puzzle.
The hospital setting was a psychiatric hospital, so I had the privilege of being part of an interdisciplinary team. So I was on a team with a psychiatrist, nurses, social workers, occupational therapists, psychologists, and I was an entry-level orderly. So basically, I'm on the unit, basically watching and learning. And so I sat on...
But watching with a unique perspective, probably. When looking at folks.
With a very intriguing job. So and part of my job was interacting and beginning to facilitate some groups and individual counseling under their supervision. So that's kind of where it started. And being in an environment that was a teaching hospital, they were affiliated with Brown University, so it was a lot of good things for me to learn while I was there. And I really soaked it up. I really found that I was destined to be a good student. And when I was back in school, I got all A's. You know, I found something I was interested in that I really cared about. I had some learning, focusing issues and stuff like that, but I've worked around them, and it's not really an issue anymore as an adult. So finished grad school, did well there as well. Really enjoyed it, got a lot out of it, and then started my own private practice. I had a private therapy practice for a number of years. And then
You should mention your graduate degree.
Sure. My graduate degree is in master's degree in agency counseling, and advanced degree, it's called a CAGS, specifically in mental health counseling. And then in Rhode Island, I have a mental health counselor license through the state of Rhode Island, and a substance abuse treatment provider license in Rhode Island as well.
And that's what your agency was about when you started, right?
Yep. I would see a lot of young adults and adults with substance use disorders. And I found that, treating people one-on-one was powerful, but I thought, I want to do something more. I want to be able to help more people. And I remember my own experiences in group therapy. And so I thought, let's start this intensive outpatient program. So intensive outpatient is just what it sounds like. It's an intensive outpatient program. You come anywhere from 3 to 5 days per week for about 3 hours a day. And you do group treatment, you do individual treatment, and medication management if you need that. So that's what we started in Rhode Island. I partnered with another gentleman, and we opened up 3 offices in Rhode Island. And before we knew it, we were very busy, unfortunately. Fortunately, unfortunately. You know,
And that's
we're
the
able to help
birth
a lot
of
of people.
Clinical Services of Rhode Island.
That's it. That's it.
Great.
So what are your thoughts on, because you say how you have medication, what are your thoughts on not using medication to cure addictive, well, not, I shouldn't say cure addictive problems, but help control addictive problems, because they're never cured. But.
Right. It's a slippery slope. When I say that, I mean you have to be very careful when you utilize medications. You know, just like any other health problem, there are some medications that could be very helpful, and there are some that could be potentially dangerous to utilize, but potentially good to utilize. So, you know, with opioid problems, I think we hear a lot about utilizing methadone and Suboxone, and those are the 2 big ones you hear of, but there's a lot of other medicines that are not opioids, because basically Suboxone and methadone are opioids. So there's a lot of stigma around that, and then there's also a lot of concern. Some people feel that, you know, if you're taking an opioid, you know, you're still affecting your addictive brain, you know. And when people are on methadone and Suboxone, sometimes some people really are not able to retain the recovery information that's being given to them because they're still impaired. So, you know, there's a little bit of give and take that has to happen, because when, you know, we're talking about life and death in a lot of cases here. So personally, my take is that if somebody needs to be on methadone or Suboxone in the beginning stages of treatment, I think it's perfectly warranted, provided they have a full continuum of care and support in place. The problem I see personally is when folks stay on it for years and years and years, because they get complacent, they may not be able to make the lifestyle changes they need. So there's a whole other slew of medications that are out there that can help too. You may have heard of naltrexone, or an injectable medication called Vivitrol. So those are medicines that are opioid blockers, but they're not opioids themselves. So safer in that regard. So again, it's no, the way I see it, my perspective, it's not black and white, and there's no right or wrong way. I think the biggest mistake anybody can make is to not have the whole gamut of services in place. Medication-assisted treatment is part of, you know, what we see as a preferential treatment for people that are dealing with this kind of problem.
So how do you address the emotional problems that are also at play here? Because I guess you had mentioned to us before the show that surprisingly opioids kind of suppress emotional feelings. So now once you're off the drug, you might be experiencing all kinds of things you're not quite ready to deal with. So how do you?
It's a good question. Opioids, for those that have been through traumas, whether it's post-traumatic stress disorder or anything like that, opioids they're painkillers, so they don't just suppress physical, you know, pain issues. They suppress emotional and mental stress as well. So that's why we need to be in therapy. We need to have therapeutic programs kind of built around that. That's what intensive outpatient is for, or intensive inpatient if you need to be inpatient, is for, to help you to kind of get grounded and learn to start to cope with how you feel. Because for many people, it's how they feel. How they feel is what's driving them to use. So if I don't cope with how I feel today, tomorrow I might be high. So it's a full comprehensive program is definitely needed. So it's not just medicate and then move on. No, absolutely not. It's not just, all right, come in for one therapy session and you're done. No, it's an ongoing process. And for many people, it takes years.
So it's why it's a good reason to stress that when it comes to mental health care as part of health care, we shouldn't limit it to 12 visits a year. We really have to kind of look at it as,
let's meet you where you are.
Right.
You know, if you had, congestive heart failure, we wouldn't say, sorry, you only have 3 visits to see the cardiologist, right?
Right.
Yeah.
So if you were thinking about that 17-year-old kid or the 10-year-old who started drinking and smoking marijuana, I mean, from that moment when you were 17, you told your parents, I need help, and all the way through your life, you've been telling this story. If you were able to go back to that I'm sure you think about this every now and again. Go back to that 17-year-old or 16-year-old or 15-year-old. What advice would you give them, or what advice did you give your kids as you were raising them? Or do you give kids now?
Raising
it seems
my
like between
kids,
that
that's a
and
good point.
the play and throughout your life, it's been an opportunity for you to share your story.
Well, I have four kids now. I have 4 daughters.
Oh my
And,
God, God bless you.
Yeah.
I hope you have 4 bathrooms.
I have 2.5 bathrooms.
Okay.
So, yeah. They don't all live at home.
Odds
now,
are better.
so.
Okay, that's good.
But throughout their life, I've tried to be open and honest with them about some of the things that I went through, and to really have good communication with them. When I see some things going on with them, I ask, and I don't take no for an answer. I respect them. I treat them with respect. But as a parent, I know that there are things that they're less likely to talk to me about unless I ask. So with raising the girls, you know, we've had good communication. I won't say that things have been perfect, because things are never perfect, but they're good kids, and some of it is luck. We know that too. Just got lucky, you know. But
I think a lot of it has to do with parenting.
yeah, well, you know, open communication is a big piece, and maybe that's a piece that, you know, when I was a young kid, maybe if I had a little bit more of that, maybe things would have been a little bit better. Maybe I could have done a little bit more. Maybe they could have done a little bit more. But yeah, that's a struggle for a lot of families, though.
But it speaks to the power of telling your story, doesn't it? It really speaks to your willingness to break out of that shell and tell your story throughout your life and throughout your career. I think is very powerful, and has had ripple effects throughout the community because of your bravery and your willingness to turn your addiction and the issues that you dealt with and struggled to something better, not just at Clinical Services for Rhode Island, but for your family and for all of us.
Yep.
So
It helps other people, but you know what? It also helps me too. So
Sure.
there's you know,
that's what it's all about.
it's all good.
Well, I hope through this discussion that we've been able to inform people about what a complex problem this is. It's not a one solution problem. There's so many different fronts that you have to battle this.
There's no quick fix.
Right, no quick fix. So I think that it is going to require policymakers to have more than one solution, and try to be really creative on how to go about this, and definitely drop the stigma. Nobody should feel ashamed. They should get the help they need, because we're all better off for it.
Yeah,
Absolutely.
That's right.
Absolutely.
Well, we want to thank you again, Peter, for coming on and doing a second show. I think it's been just really, personally, very informative for me, and thank you again.
Pleasure.
And, thank you very much. And again, I'm Steve Kerrigan. You can find this and past shows on Vimeo. Just search there for Southcoast Matters, or also look on Facebook under Southcoast Matters. And Peter, again, from myself, you've made the 2 shows that I've co-hosted really a valuable experience for me, and I'm grateful to have a chance to hear of your experience and learn a lot from you.
Thank you very much for having me.
Well, I'm Julie Taylor, and thank you again, Steve Kerrigan,
Julie.
for co-hosting.
Thank you.
And today's show was filmed on March 13th, 2017 at the TCAM TV studio here in Taunton. Thank you for watching.
Thank you to Kim Murphy, Ben Fortier, and Walter Sabina at TCAM TV in Taunton for the use of their studios and their valuable help, without which this show would not exist.